Hi, this is Dr. Eric Janowitz talking to you today about natural ways to take care of TMJ. By the way, what is TMJ? TMJ is the joints that are along the side of your skull. And if you have TMD, which is Temporomandibular Dysfunction, which is a condition of the TMJ, that is where you might have abnormal motion of the jaw, either popping or clicking, pain as well. Your mouth can even get stuck open. That's right. So TMD is not a fun condition. Now, if you go to your dentist is going to provide you a lot of technology to help you out by working on things like night guards or to make sure the teeth align perfectly there and don't compress and irritate the muscles. But here's the deal. After that, many of them prescribe to you or refer you out to an oral surgeon. You heard me right, oral surgeon, which means their specialty is surgery. So if you're looking to avoid surgery or having to be reliant on medication and looking for natural ways, here are several ways that you can do by correcting your TMD. Hey, let me take a look at that skull. Bam! So when we look here, there are multiple ways to take care of that. When we're looking here, there are muscles that are surrounding the jaw joint itself. You have the masseter. And so there is techniques to release the masseter by doing a technology called manual therapy. And that's where a therapist can entrap these muscles and then have you go through a series of motions to then stretch and release the tightened muscle that might have been caused by clenching or bruxism as well. You also have the temporalis muscle, which is along your scalp, and that muscle can also be affected that we have to work with as well. Now, a trained therapist can also work inside the mouth and work in muscles such as the medial and lateral pterygoid as well as the digastric muscle, and then you cannot forget the cervical spine muscles up here as well. In fact, cervical spine, let me see that model here. Bam! And when we look here, the cervical spine also has to be addressed as well. So working with a chiropractor in conjunction with your dentist is absolutely critical if you want to prevent TMJ for continuing to be in that cycle. So making sure the alignment is perfect, having what's called a cervical lordosis or curve in your neck is critical, and making sure there's no irritation to the nerves here which go up and can affect the muscles to the jaw as well. Now, we also use technologies such as class 4 deep tissue laser to work on the tightened muscles as well, to release them and to allow us to handle that. And finally, a trained chiropractor can utilize technology such as an instrument-assisted adjusting tool to literally work on the adjustment and the alignment of the jaw to make sure that it's working perfectly. A way to test if you might have TMJ or TMD, for that matter, is if you look in a mirror and you open up your jaw and you see it start to veer to one side, then that's going to tell you that the jaw is not aligning perfectly and the joint is not working properly, and that'd be a good candidate for seeing if chiropractic can work well with your dentist as well. So if you're looking for someone to help you out with that, please subscribe to our other videos or click on our link to our website. Thank you.
I was trying to get that thing to lower as he's like
That was great.
signing out.
I thought that was good.